Goeiedag! Good day, fellow South Africans and citizens of the world. And yes, there is no confirmed coronavirus case yet in Africa. But I think that's because of what you'll hear about in the video. I believe the coronavirus is alive and well in Africa right now and probably spreading madly. And of course, in South Africa, unless you're showing symptoms of coronavirus, you're just let through at customs. Now let's remember that it's infectious while there are no symptoms. So people could be walking through customs in Cape Town and in Oliver Tambo, coming from the Middle East or from Asia, have the virus be infectious and just be allowed to go straight through into the community. Great. Okay, now that's the starting point. That is a fact, okay, that's how it is right now in South Africa. Now, what about the rest of Africa? This is where it gets absolutely crazy. At a Chinese-run hospital in Zambia, some employees watched as people who recently returned from China showed up with coughs, but were not placed in isolation. A doctor tending to those patients has stopped coming to work, and health workers have been ordered not to speak publicly about the new virus that has killed hundreds around the world. The virus that has spread through much of China has yet to be confirmed in Africa, but global health authorities are increasingly worried about the threat to the continent, where an estimated 1 million Chinese now live. As some health workers on the ground warn, they are not ready to handle an outbreak. Nowhere in Africa is. Countries are racing to take precautions as hundreds of travelers arrive from China every day. Safeguards include stronger surveillance at ports of entry and improved quarantine and testing measures across Africa, home to 1.2 billion people and some of the world's weakest systems for detecting and treating disease. But the effort has been complicated by a critical shortage of testing kits and numerous illnesses that display symptoms similar to the flu-like virus. Dr. Michael Yeo, Emergency Operation Manager in Africa for the World Health Organization, said, "The problem is, even if it is mild, it can paralyze the whole community." Those growing worried include employees at the Sino-Zambia Friendship Hospital in the mining city of Kitwe in northern Zambia, near the Congo border. Chinese companies operate mines on the outskirts of the city of more than 500,000 people. One company is headquartered in Wuhan, the city at the center of the virus outbreak. Hundreds of workers traveled between Zambia and China in recent weeks. Physiotherapist Fundi Sinkala said, "We're definitely not prepared. If we had a couple of cases, it would spread very, very quickly. We're doing the best we can with what resources we have." The Sino-Zambia Friendship Hospital, or Sinozam, a low-slung facility near the city's train station, has taken some precautions, including checking patients' temperatures with infrared thermometers and establishing isolation areas. Employees wear masks. Gloves, disinfectant and oxygen inhalers have been stockpiled. Sinozam treats many Chinese in Kitwe, and its precautions go further than other hospitals in the area. But the employees and others familiar with the matter, some of whom spoke anonymously under the new rules, say some Chinese patients checked in with coughs and fevers but did not get placed in isolation. Go figure. Could only just be coronavirus. Visiting Zambian health officials concluded the patients did not merit special treatment and did not take samples to test for the virus. After the people recovered, they were sent home with antibiotics, employees said. On Wednesday, the hospital set up a new fever clinic, to which people arriving with a high temperature are now ushered to right away. "It's unfortunate the ward wasn't set up earlier," Sinkala said. Two people familiar with the matter say a doctor tending to the sick has fallen ill. Dr. Yu Jinlan has not come to work in the past week, and hospital administrators have not explained her absence, Sinkala said. The other person spoke on condition of anonymity for fear of retribution. Hospital Administrator Li Zimbing said there were no patients with a fever and said you had a urinary tract infection, not a fever. But a notice posted by the Zambia Chinese Cooperation Zone, which manages the hospital, quoted an employee as saying on the 27th of January that the facility probably sees 120 fever patients a day, and at least 70 of them are carrying germs of various diseases. Earlier this week, a Zambian official acknowledged for the first time that his country was following up on an unspecified number of suspected cases. Zambia is one of 13 African countries identified by the World Health Organization as a high priority because of busy travel links with China. Copperbelt Provincial Health Director Dr. Robert Zulu, who oversees Kitwe and the surrounding region, told the Associated Press he would not discuss details, citing privacy, but he added, "When any case is confirmed, you will be informed." Crucially, no one in Zambia has been able to test for the virus so far. Like most African countries, it has been waiting for a substance known as a reagent, which labs require to confirm whether a patient is infected. So, what they're saying is there's no way they can actually test patients who are sick for the coronavirus. Absolutely extraordinary. Labs in just 6 of Africa's 54 countries were equipped as of midweek. That means a wait of 2 or more days to know whether a sample shipped to South Africa or even outside the continent tests positive. Without testing, officials are just relying on the symptoms and whether they persist. Sinkala said, calling the hospital's biggest worry, "But from what we are learning right now, some people show hardly any symptoms at all." Zambia is one of the additional countries the World Health Organization planned to equip by the end of the week. As of Friday, the World Health Organization Emergencies Chief, Dr. Mike Ryan, said 28 labs across the continent could diagnose the new virus. Adding to concerns at Sinozam, 3 employees said Zambian health officials visited on Tuesday and have been testing the bodies of 2 Chinese patients that have been in the morgue for days, though some added it was an overabundance of caution. Lee, however, dismissed the accounts of testing the bodies as rumours. He said one died last month of malaria and the other of a heart attack. The bodies are still there because family members in China wish to come and pay respects, but cannot because of the outbreak, he said. Zambia Health Ministry spokesperson Dr. Abel Kabalo called the employee accounts of events at the hospital very strange. He vowed that if Zambia confirms a case, authorities will definitely inform the world. "It's pointless to hide information," Kabalo said. The World Health Organization says countries are obligated to inform it of confirmed cases and are requested to report suspect cases as well. The World Health Officer Chief has publicly urged countries to share information. So far, African countries appear to be complying. A World Health Organizer advisor on health security, Dr. Ambrose Talasuna, told reporters. Several African nations such as Ghana, South Africa and Ethiopia have announced their precautions, including updates on negative test results for suspected cases and demonstrations of surveillance and quarantine capabilities. Ethiopian Airlines, however, faces questions by some in Africa about why it continues to operate more than 30 China flights a week, while other African airlines have suspended theirs. Adding to the difficulties in diagnosing the new virus are numerous diseases in Africa with symptoms that include fever or coughing or both. It's impossible to diagnose the new virus by symptoms alone, Gates Foundation CEO Mark Sussman said, adding that there is a significant likelihood that the virus will be confirmed in Africa, and there is a risk that panic overtakes good public health and good science. The foundation has committed up to $20 million to help health authorities in Africa and South Asia, another vulnerable region, improve their disease surveillance, isolation and treatment for the virus. Concerns are high amongst some in Kitwe. A local pharmacy manager, Edward Goma, estimated that his business has sold more than 800 face masks in the past few days. He said, so far everyone is scared, and yet he has not noticed the stricter surveillance measures seen in other countries beyond temperature checks at the international airport, an hour's drive away. Now, I have to tell you that just today I went to the major shopping centre here in the area in Brisbane where I live, and everyone is sold out of face masks, hand sanitizers completely sold out. All the sort of stuff that we're talking about that you need to prep and get is being sold out here in Australia. Here in Australia. The lady at the pharmacy with the face mask said they haven't had them for 2 weeks. They said they've got a huge backlog. This is happening now. The 15th Metallurgical Construction Group, based in Wuhan, said on its website that its overseas operations in Zambia and Congo must purchase masks, disinfect living quarters and workspaces daily, and check workers' temperature 3 times a day. Chinese employees are temporarily barred from returning to Africa, while those in Zambia are not allowed to go to China, said Lee, the hospital administrator. Chinese embassies in Zambia and elsewhere in Africa have been unusually outspoken, giving news conferences and television interviews to discuss their response to the outbreak. Embassies require arriving Chinese citizens to declare where they have been in China. They also urge citizens to voluntarily isolate themselves for 14 days. The Kitwe-based president of the Mine Workers Union of Zambia, Joseph Chewe, said, "We are now practicing hygiene even in the mines. Any report of a person with coronavirus here will be very disastrous." So, this is the bottom line. Okay, it's a perfect storm, guys. It's a perfect storm. You've got hundreds of thousands of Chinese returning from, including Wuhan, back into Africa. A lot of them are coughing and sneezing and showing signs that could be coronavirus, but in Africa there are very few places that can be tested. And in Zambia they're not even testing for the coronavirus. So what they're doing is sending people home. Now, they can infect other people if it is a coronavirus. Here comes the real killer punch as far as I'm concerned, and that is the fact that you don't have to show symptoms to be infectious. You can pick up the disease, and 3 days later, you can be infectious, but you don't start coughing or spluttering until a week later. So you got a week of infecting other people before the symptoms appear with you. This is how highly contagious, how highly dangerous it is, and yet South Africa are letting people just come into the country. Crazy. Australia and New Zealand, no way. You come from those areas, you go into quarantine and you stay there for 14 days plus. And the latest report I've heard is that the actual period of time for it to actually manifest itself from the time you get infected can actually be up to 28 days now. So you can go for 28 days carrying the virus before you actually start sneezing and coughing and carrying on. That's the latest information I've heard, and that this is from a very, very reliable source. So it's getting more and more crazy. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe.